Hello and welcome back to Health Serum. Today we're going to discuss heart failure. The heart is a muscle that is used to pump blood throughout the body. There are two sides of the heart. The right side of the heart, which receive unoxygenated blood from the body, vessels and cells, into the right atrium, which travels to the right ventricle with fluid in your lungs and difficulty breathing and things of that nature. It then causes problems with lung issues, breathing issues, oxygen issues. And some of those symptoms that occur during this process is like coughing, shortness of breath, swelling of your extremities, your arms, just swelling all over the body sometimes, irregular heartbeat, unexpected weight gain because of the swelling or the fluid volume overload in your body, pain in your upper torso, which is your liver, which filters everything through your body, which can cause liver congestion too with the backup of fluid. But the causes can also be from other health issues. So this can be a result when you are a patient with irregular heartbeat, diabetes, hypertension, a smoker, or obesity. So these are the things you want to look out for and the signs and symptoms you want to look out for if you have these health issues as well. Right-sided heart failure, which is also called pulmonary heart disease because it's the process to process the oxygenated blood throughout the body through the left side of the heart. Again, the ventricle is unable or not strong enough to pump enough blood through to the lungs to be oxygenated and transferred to the left side of the heart, which is then transferred throughout the body. So it also causes some of the same symptoms like swelling, edema, but it also is affected with problems from the left side of the heart. So basically both sides of the heart works together, okay? So if one side is not working effectively or does not have enough strength or is not strong enough to process the blood flow from one side to the next as it is supposed to do naturally, it will cause all those signs and symptoms in heart failure. So because the heart is weak, then it triggers the nervous system. And what the nervous system does when it's triggered, it creates stress hormones. So it automatically, because the body normally heals itself, so it automatically tries to pump or put more stress and energy in trying to pump the heart to help release the blood that is needed to the heart. And because of that, it makes the heart weak because it overworks it, because it's kind of not the natural way of pumping the heart. And it often makes heart failure worse. And it can damage the heart muscles as well as the ventricle walls. So over time, the ventricles delivers less blood throughout the body and gets weaker and weaker. Coronary artery disease is actually one of the #1 causes of heart failure. So these are the things you want to look out for, right? Even before you want to monitor if you have these comorbidities before even getting heart failure. There's many treatments for heart failure. As we know, there's medication, right? Which oftentimes have side effects. So we don't really want to get that far. And if you've watched my videos, you'll see that diet and exercise is always a preventative measure getting these health issues, right? So if you continue to eat a heart healthy diet, low sodium diet, you want to decrease your sodium for heart failure because sodium increases fluid volume in your body. You want to eat healthier, more vegetables, not so much fats or carbohydrates, which convert to sugar. And alcohol is another thing that you want to monitor with heart failure because that contributes to it too. You don't have to go cold turkey, but you want to limit your alcohol and your sodium. Those are two main things. Well, one of the medications that are used is called an ACE inhibitor. And what that does is it expands the blood vessels, right? So that the blood can flow through the body easier. And then there's the beta blocker. Beta blocker is more of a stress reliever. So it helps decrease the stress that the nervous system provides to help pump the heart when you're in heart failure. However, it also decreases your heart rate. So that has to be monitored. Do not take beta blockers if your heart rate is under 60 beats per minute. Because that could cause a whole nother problem. So that's something you have to monitor, but those are the two main medications that people with heart failure are on, as well as diuretics, which decreases the fluid from your body through your urine. Okay. And there's furosemide, which is diuretic. The only thing with that one is that also depletes your potassium, which is very important for your heart. Therefore, a lot of people who have low potassium use spironolactone, which is a potassium-sparing diuretic. So just keep that in mind when you think about your options in medications. Okay. Some of the natural remedies, which is my favorite, is, again, diet and exercise. So exercise has also been known to relieve stress, also been known to keep the heart pumping so that it could push blood through the body naturally. But carnitine is one of the health medications that you could, the health supplements that you could use for heart failure. And what it does is it turns fat into energy, which provides you more energy to work out, and also it increases your heart rate because your energy is up and you're able to exercise more. Then your heart rate works harder to pump, which helps fuel the blood through your body naturally. And then there's coenzyme Q10 is another supplement that converts food into energy, and it also increases the production of cells. That gives you the strength to pump the heart to provide blood flow throughout the body properly. One supplement that's very popular since I think the 1st century is called hawthorn. So that's a supplement that's been used for heart disease over years and years and years. What it does is it reduces free radicals. Another natural supplement is called hawthorn, which has been used since the 1st century to treat heart disease. It's also effective for respiratory issues. Hawthorn also fights against free radicals in the body to produce healthier cells. The supplement B1, which is also called thiamine, converts food into energy and also helps to reduce stress in the nervous system. As we discussed, the nervous system goes into overload when the heart is unable to pump blood effectively, which puts more pressure onto the heart. So vitamin B1, which is also called thiamine, assists in this area because it reduces the stress level in the nervous system. So again, to prevent heart issues as well as other health issues, it's very important to focus on diet and exercise as a primary resource for prevention. Following a heart-healthy diet when you have heart disease could help you reduce the use of medication and reduction of the disease. So let's all just concentrate on being healthy, watching what we eat, getting some sort of exercise. I don't care if it's 30 minutes a day. I try to do that myself. That can prevent a whole lot of issues before they even get to the level of medication. Thank you again for tuning in, and I look forward to any comments, any questions, any suggestions on any other topics of health you'd like to discuss, and let's just all stay healthy together.